premises. When patient calls the hospital to get an appointment, receptionists can book the appointment by selecting empty slots of the doctor. Receptionists can select specialty and doctor name. Just right-click on the empty slot, click New, search for patient, and fill in some mandatory details. Receptionists can either search for existing patient with UHID, phone number, national ID number, etc., or register a new patient. She can also take a picture of the patient and print the registration card, which patients can carry with them. Registration cards can be scanned by barcode scanner to pull up patient's information. From the same page, outpatient visit can be created by selecting visit type, department specialty, and doctor name. Nurse dashboard can show new patients, nurse seen, doctor seen, and visit complete. Nurse will select new patient and collect vitals and allergies. Nurse can also do the rest of the things as shown in the video if we give access to nurse to perform these activities. But usually these activities are performed by doctors. We also have triage system that shows the health condition of the patient with color coding and score as per the age and the vitals collected. Doctor can see the same dashboard as nurse, and he can check patients from different departments like outpatient, inpatient, and emergency room. Once doctor gets into patient's data, he can document present complaint of the patient, history, and examination. He can also order lab and radiology test in Investigation Procedure tab. He can give prescription too, and all the orders will reflect in the respective departments. Doctor can give advice, like calling the patient for a follow-up visit, request for surgery, request for administration, transferred to another doctor and a hospital, or visit complete. He can also give medical certificate, which is template-based, so we can import any template as per client's choice. He can document progress notes too in Doctor Assessment tab. Our software is completely customizable as per doctor's specialty and client's unique needs. We have a complete package of inventory. In pharmacy is part of inventory module, as you can see. We can create different stores in inventory and maintain the stock. Detailed demo on inventory will be shown in another demo, or you can ask for it. So we go to the pharmacy store and do outpatient sale for the medication that is prescribed by the doctor. You can search the order by clicking on Doctor Order button or with the help of Registration ID. Here we are making the medicine ready so that the pharmacist can dispense the medicine after he receives the payment from the patient. Here you can see all the pending orders that are given by doctor. If you want, you can give discount to the patient, percentage-wise and amount-wise. While collecting payment, you can accept it in different currencies and in different payment modes. Once you collect the payment, a detailed invoice will be generated. You can hand it over to the patient. We can also design a different format of the invoice as per your requirement. We also have an insurance module that will be shown in another demo. Once the payment is made, the patient will go to the pharmacy to collect the medicine. So again, we go to the inventory module, select the store, and select medicine dispense. You can also check the status that the medicine is ready to dispense. Once you select the medicine and click on Save, the medicine will be dispensed and it will deduct from the stock. Now we will go to phlebotomy to collect blood sample. This is an option and we can remove it. You can see the order directly in Lab module too. Here you can select the order, collect blood sample, and dispatch it to the lab. You can also see the status of the order as per color coding provided. Once you receive the sample from phlebotomy, you can select the order and acknowledge at first that you received the sample. Then you can start doing the investigation and input the result entry. If you do lab integration, then the results will populate automatically. Once the result entry is done, you can put it for finalization, and it will show in patient's health record, and doctor can check it. Same goes for radiology as well. You acknowledge the order, start doing the investigation, input the result entry, and send it for finalization. The only difference here is you need X-ray images, and the results should populate automatically. You will have to do PACS integration. It is a different software specifically for radiology images. We can also suggest a best PACS vendor to you. Now, let's talk about inpatient module, which is mainly used for admitted patient or to admit patient. You can see all these options on the left navigation band. This is the patient admission page, where you can admit the patient by selecting ward, floor, room type, etc. Bed status. Select ward or floor, and you can check which bed is occupied and which one is empty by clicking on bed status option. And you can also select vacant bed from here. You can transfer patient from one doctor to another. You can transfer patient from one room to another or one bed to another. While discharging the patient, you can select date, status, doctor, and department. You will get more information in the nurse station module. As soon as patient is admitted, nurse will start performing her activity. She will search and select the patient. She will start filling the nurse form, assessment form, and monitoring chart. These forms are template-based, so you can provide us the template and we will import it for you. Nurse shift assessment form will show you documentation of nurse who are doing 2 different shifts. Then we have a monitoring chart. Partograph is there just to give you an example. Similarly, she can check doctor diagnosis and his notes. She can also make her notes so doctor can see it. She can collect vitals, service orders, and all other things that you can see in the left navigation band. She can request for consignment, blood, drug, and at the same time she can acknowledge that she received it and return it too. She can also do the administration, like when the next dose is due, if it is delayed, etc. She can do discharge planning, document summary, and notes. All these things are template-based. Once you search for patient, it will show you the total bill amount. But if you click on the amount, which has a hyperlink, it will show you an itemized bill where you can see charges for each service and room charges too. You can upload scanned copies of patient document by selecting a folder, or you can create your own folder. Then we have operation theater notes, consent forms, CSSD request, and ambulance request. These are the list of patients who are admitted in the emergency room. Once you click on the ellipses of any patient, it will show you what all the activities are that you can perform, like service order, allergy, investigation, transfer to inpatient, billing, discharge, emergency forms, vitals, medical record, doctor note, bed transfer, sample collection, blood request, consent form, medical certificate, etc. So it's a complete package, and if you would like to see a detailed demo, please ask for it by visiting www.adroitinfosystems.com. Thank you.